Thank you, Kelvin. Due to some technical issue, for the upcoming speakers who will be presenting, we would like to ask for you to click the raise hands button once again while speaking. Mr. Houston, feel free to begin whenever you're ready.
Thank you, MC. Okay, let me share slide first. Okay, is everything good? The sharing stuff? Okay, so good morning, everyone. I'm Houston, and today I'm talking about role of physiotherapists in SDG. I think a lot of people are thinking physio. I think most likely they'll think, oh, you are massage, you are masseur, but not that easy. So I will sharing more about in this session. So a little bit about myself. So I'm a bachelor degree in physiotherapy from Anglia Ruskin University and MAHSA University. So at the same time, I also ISST Schroth Method certified therapist. So this technique is from Germany and is specially designed to help people in spine problem like scoliosis. Okay, so I'll explain more about how physio started. It's actually started from First World War, when people and soldiers fighting and then they have the injury and then the amputation. So they cannot go back to their life normally and then to know how to do it. That's why physio stand up and help them to rehab them and then teach them how to go back life normally. And this is how we start our journey. And then look into 2021. Now physio have a lot of special skill. And even in cardiorespiratory cases like COBB, a major surgery done in the heart, they still need to do 3 months of physio rehab in order to strengthen their hearts and then their joints to go back to their normal life. And then even like neuro cases, then as we know, stroke cases rehab, then everyone knows is going to be physio to happen. And then the Jerry, the elderly cases, and then the PITS. I think PITS, nobody, a lot of people don't know that. Like baby, they're having the sputum problem or the flame like pneumonia, having infection in their lung. It's actually the physio to help them, we have to do percussion and then to do the suction and then to suck out the sputum and then the flame and to let them have breathe normally. And in women's health and osteo cases like the fracture or even like the accidents. So the importance of physiotherapy. So even World Health Organization, WHO, suggested that patients with low back pain should go consult doctor for reassure about the absence of serious pathology like cancer or tumor or other things that cause you back pain, Once the doctor check is, yes, you are clear, you are normal, then you should go undergo physiotherapy, psychologist, or acupuncture for further treatment. So you can see the importance of physiotherapists. And why is that so? Actually, all physiotherapists, we have evidence-based practice. I doesn't like physio when the MC Grace coming to me, I will simply whatever I like, I give the treatment. Actually, it's not. I have to assess first. What is her patient value? What she comfortable and not comfortable with? And then through the clinical experience, then I know which treatment is suitable for Grace. But how? Actually, it's through the base scientific evidence. What is evidence mean? Which means all conditions we have should do all the research that done like this treatment is suitable to treat this condition. Then I'm confident to give this treatment to Grace, which means not only me, but all the physiotherapists will practice the same thing in order to approach any patient and to give the best treatment for the Grace, or for other problem people. Okay, so next. So we have a lot of SDG, like 17, but actually health is a contributor to several of the SDG. Although we have a lot of SDG, but without health, right? Like priorities of the post-2015 agenda for sustainable development will remain aspirational unless the strategy to transform the health workforce capability are put in place. Mean, no matter how many goals or how many plans we have, without a good health and well-being, we have no people to execute it or to achieve it together. So physiotherapists are an ideal health workforce to address the good health and well-being, and even we can achieve the decent work and economic growth and the climate changes. So ever since the WCPT, health is first international meeting on evidence-based physiotherapist in London, 2001. The importance of research-based practice and effect of the intervention has been emphasized, and clinically oriented research has increased exponentially. So I'm glad to say that the physiotherapy evidence database PEDRO provide access to over 49K randomized control trials, systemic review, and evidence-based clinical practice for everyone all over the world. So in 2020, over 3.8 million users from over 200 countries perform a PEDRO search. What does it mean? Which means all the clinical professional or caregiver can access all this research and then to give the best treatment for their client or for their patient. So it's a very good news, we can practice it. And SDG 3, the target 3.3, we have to fight the communicable disease, AIDS and tuberculosis, TB. So we have to reduce it. But what about the people already having it? What we should do? Actually, that's the physio coming. Exercise in particular as part of behavior modification and improvement in lifestyle has been shown to contribute positively to preventing complication of HIV and increase longevity in person living with HIV. So like TB is a disease of public health importance in Malaysia, with 25 cases of the disease recorded nationally in 2018, and an estimated incidence rate of 92 cases per 100K population. So it's important. Exercise prescription form the basics of management program for the patient with chronic respiratory disease like TB. Allow them to have better quality of life and back to active daily life as soon as possible. So we talk a lot about the communicable disease. Now we talk the NCD, non-communicable disease. Among the office worker, like everyone sitting in front of Zoom, right? 70% of employee or everyone show a high pain severity score in the low back, shoulder, and neck. So lost work of productivity because you pain here and pain there, and additional sick leave, both of which contribute to an increased economic burden on employer and can result in large economic burdens by having a negative effect on GDP, gross domestic product. So when you have pain, please seek for professional help. Okay, you can tell this to your boss. If not, I'm the burden to your company. So physiotherapist is both clinical and cost-effective in optimizing health across the lifespan and in the management of NCDs. So there's a lot of misconception, like a lot of people think pain is a condition, but no, pain is actually a signal. It's a symptom to your condition. Today you have pain in your shoulder. It might not your shoulder is a problem. It could be your spine. It could be your joints. So you have to learn the pathophysiology of the pain. Not need to go by book, but you have to learn through the profession. So find the professional to treat the pain from the root cause. Then you won't keep having the recurrent pain. So this is the vicious cycle of pain. A lot of people having pain, and then what have they done? Like avoidance of behavior, because you have pain, so you are scared to move that movement. Like shoulder pain, you are not there to lift up, and then you decrease your mobility. And then you alter your function status and even diminish your self-efficacy, which means when you're cooking, you're not there to reach out to get the ingredient one. So you also will social limitation yourself, and you're not there to go because of your pain. And then the cycle go back worse and worse again, because the pain will come in more and more because you never address it properly. I never forget the years of practice in hospital in Penang. There's a lot of patients coming to me because I work in charity hospital. So there's a lot of patients that in stress when they have pain, because if they cannot work, then the boss most probably will fire them because they cannot conduct the productivity anymore. So it's important to address the pain properly. And luckily to them, and then they have the better life now, and then after the pain is gone, they can go back to their life, work life, and then to feed their family, feed their kids. So what we need to do to break the vicious cycle in order the recurrent pain won't come back, it's easy. You need to do the assessment first. You need to find out what is the root cause of your pain. If you find it's the weakness, then you strengthen it. But if you find it's a tightness that causes you have the pain, then you stretch it. Or even the posture can cause you the pain. Then you have to recorrect the posture. Not only massage, massage to relax the muscle is only temporary. But what costs you the long-term thing is maybe your posture. And then the last but not least is the education. Patient must know why they're having pain. You must always ask your physio or doctor why you're having this and how you prevent it in long term. Or otherwise, you will see me every month or even every week. Yeah. So no matter communicable or non-communicable disease, physiotherapists are one of the healthcare professions with knowledge and competencies to be in key position for taking ethical responsibility for the future and contribute to enable participatory society as well as good life for everyone. So overall access to essential health service have improved, but physiotherapy service coverage in rural area are still needs increased availability. Remember, SDG, we will leave no one behind. Even rural region should enjoy the same quality physiotherapist rehabilitation. But what we should do in order to achieve this goal? I have one idea. In next year, I'm going to build a mobile physio center. I will build all what I need, all the equipment, even a bed inside a big van. So the patient not need to drive very far from rural area to city, or even city people were having the traffic jam problem or finding parking problem in order to receive their treatments. So we change the game. You order and then you make appointment with me. I go to your area. So it's time saving for both of us. And you can rehab yourself and recover yourself from the comfy space. Because in the van there, it's very big and I can design it is very comfortable, the atmosphere and environment. So with this mobile physio center, quality physiotherapy service is no longer a privilege for urban citizens. So I still remember when I'm working in Penang as physiotherapist, I always busy and have no time to go back home. Even my parents in Johor suffering from pain, I also can't help them. And nearby have no physiotherapy center to help them. So this is very sad because I myself study a lot, but I cannot help my parents far away. So that's the reason why I want to build a mobile physio center to allow more physio can travel to help and provide quality physiotherapy service to the rural area. So the reason I stand up and sharing is I want to educate public about physiotherapists is not a martial. Okay, so don't order your physiotherapist say, can you massage me here and massage me there? And also it's essential for physiotherapists to re-evaluate their roles in prevention and treatment of NCDs. We physiotherapists are equipped with the knowledge to understand the initial cause of ailment and can therefore be leader in prevention by offering advice and guidance on how to avoid the root cause of disability. I also urge more people to join the participate in SDG to achieve a better and more sustainable future for all. Youth today are the change maker. Thank you.
Thank you so much, Mr. Houston. I do believe that it is very much eye-opening for most of us, if not for all.